Today we are going to start the nervous system. When we think about the nervous system, we should think of a control system. There isn't any function in the body that doesn't have to do with the nervous system, okay? As simply as raising your hand, the nerves have to fire a response, creating the muscles to contract, which then raises your hand in the air, okay? Your blood pressure getting elevated, that happens because there are sensory organs that are gathering information that there is some sort of threat to you, and then you start that fight or flight response that is part of the nervous system. Okay, so when we think of the nervous system, we think of a master controlling and communication system. Okay, so every single action, every single emotion, every single thought that happens is a reflection of the activity of the nervous system. It communicates by sending electrical impulses throughout the body. The nervous system has billions and billions of nerve cells that work together to control, like I said, every thought, every action, every emotion. Couple of vocab terms to look at, differentiating between nerve cells and nerves. Okay, when we say nerve cells, we're talking about the individual teeny tiny cells, and we call those neurons within the nervous system. Then a collection of those neurons is what we call a nerve. Okay, so if we say something about a nerve, we're talking about a collection of neurons, lots of little neurons. That collective group of neurons is what carries those electrical messages throughout the body. Another vocab term for us to look at is stimulus. Stimulus is what begins an impulse of those fibers of a neuron. So a stimulus is any change, whether how big or how small, in the internal or external environment. So those pictures on the left, if we're out grilling, which hopefully a lot of you have been able to grill over the last few weeks with your families, because we've had some nice weather. And so if your dad is out grilling steaks, and you can start to smell the smell of steak grilling in the air, based on the meat cooking, you can smell that stimulus, and that makes you hungry. Or maybe you hate steak and it makes you irritated or kind of nauseated. I don't know. We can feel cold. Okay. Hopefully we won't have any more of that this year, but we can feel cold when we go outside and know that we need to put on a coat or a hat or some mittens. We can hear sounds. We can feel pain, and we can feel heat. Okay, electrical discharges of the neurons can be caused by, like we said, either external stimulus or internal stimulus. Those electrical discharges are what we call nerve impulses. Okay, so I'm driving along and I see a red light, and with my eyes, I see that red light. I send that message up to my brain, and my brain says, "Whoa, red means stop." And so then that message, red means stop, goes back down to my right foot. My right foot hits the gas pedal or the brake pedal, not the gas. Maybe, I guess, if I'm trying to get through the red light really quickly, but it should hit my right foot on the brake, so then I stop. Okay. Um, An example of an internal stimulus would be maybe I just had some candy because we're all binge eating right now, right? With all the time we've had away from our normal activities. And so I've had a bunch of candy and my blood sugar rises because of all that candy. And so then my pancreas dumps out extra insulin to get that blood sugar level back down to where it's supposed to be. Okay, so when we're looking at external versus internal stimulus, external are gathered by those sense organs. So things we see, things we hear, things we touch, things we smell, versus internal stimuli, which are sensed by internal chemicals like acetylcholine. When we look at just general functions of the nervous system, we talked about how it controls every action, thought, and emotion. And it does that by monitoring changes that are occurring both within the body and outside of the body. Okay. So it monitors those changes and sends it to the brain, and then the brain processes and interprets that input and determines some sort of response. Those changes are what we call stimuli, and that information that is gathered by the sense organs we call sensory input. Okay, then it either affects or causes a response by activating some muscles or some glands by some sort of motor output. Okay, so it's even called a motor output if it's something that's occurring within the glands, like the example of me eating all the candy and my blood sugar rising, and then my nervous system saying, "Whoa, whoa, this blood sugar is way too high," and and sending a message to the pancreas to output that insulin to bring that blood sugar level back down. When we're talking about the nervous system, we can divide it one of two ways. We can look at the structural classification, which is looking strictly at the parts of the nervous system and dividing it based on the parts. Or we can look at the functional classification, which is looking at what functions are taking place. When we look at the nervous system, if we're looking at it structurally, it divides into the central nervous system and the peripheral nervous system. When we think of central, we should think of the center of our body, kind of that midline. So the brain and the spinal cord. Peripheral, when we hear the word peripheral, we should think about maybe peripheral vision. And we think of that as like mom having eyes in the back of her head, right? So mom's looking straight at you, and you can smack your brother or sister where you think you're out of their vision, and mom still sees it. Okay, it's out to the side, away from the center. So those structures are cranial nerves, spinal nerves, plexus, and peripheral nerves. When we're looking at just the peripheral system, carry impulses between the brain, the head, and the neck. And I just noticed that I said bran instead of brain. But the cranial nerves, when we hear cranial, we should think of the brain. Okay, so those nerves occur all in the brain and send messages kind of to the upper part of the body, the head and neck. Okay. This picture is an example of the cranial nerves. Okay, they're all named. They're numbered 1 through 12, but then they're also named. And their name gives you a little clue as to what their function is. Now, with the change in schedule, you're not going to be responsible for knowing the cranial nerves or their functions. Okay, but if you hear one, you should be able to somewhat recognize it. Okay, so there are several. Oculomotor. When we see oculo, we should think eye. Motor, we should think movement. So we know that that happens with eye movement, oculomotor. Okay. Facial. Okay. We should think of the face, which is movements of the face, and vestibulocochlear. Okay. We should think of hearing and balance. Okay, so you should be able to at least recognize those names as cranial nerves, but you definitely do not need to be responsible for all their functions. Okay, Contrary to cranial nerves, the spinal nerves come out from each level of the vertebrae, and they're named based on what level they come from. So C2, the spinal nerve C2 comes from that C2 area, okay? And they all have certain areas that they innervate. They both provide sensation and a motor response, okay? Again, you're not going to be responsible for knowing all those sensations and where they're at, but we should know that spinal nerves represent a certain area and they both provide sensory input or sensation and motor. This would be why, if you've ever seen me in the case of a suspected spinal injury, asking someone, does this, as I'm rubbing maybe their shin, does this feel like this, and comparing it to the other side? Because we can tell whether there's damage to um, that spinal nerve based on where that sensation is or the lack of sensation. Okay. So that's why we get a little panic sometimes when we are testing that and one side doesn't feel like the other or they can't feel it at all. Okay. So if I were, we had someone down with a suspected spinal injury and I were touching their calf, anywhere on their calf, and they didn't feel it, then we would worry that they had, maybe an L4 or an L5 issue. Okay. You all remember very well, I'm sure, going through when I was having my back issues. Okay. And it's something I should have thought of a long time before I did, but I didn't really put the pieces together because it was talking about my body. And so I guess I wasn't really thinking clearly. But last summer, I had ramped up some of my workout programs, and every night when I would get to bed, I would have this just excruciating pain on the lateral part of my shin. It would start about my knee, and it would go all the way down to my pinky toe. Okay, and it was just horrible pain, both legs, sometimes down the back of the calf, and I just thought it was weird and thought maybe I was overdoing it. But when you look at that picture, and if you recall, my spinal issues are L5 and S1, which, if you look at the picture, L5 is that very lateral part of the calf, which is exactly where all my pain was, and S1 is on the backside across the gastroc. So it makes perfect sense that I was having all that pain, with that being where my issue was. Another vocab term for you, plexus. It's a large network of nerves within the peripheral nervous system. There's a brachial plexus, cervical plexus, and a lumbosacral plexus. If we look at up here, kind of where it's coming out, I don't know how well you can see my cursor, but coming out of the cervical spine, okay, and then it's coming down to the arm, that is what we call the brachial plexus. And anyone that has played football has at least heard of or possibly had a stinger or a burner. And that is basically stretching of that brachial plexus. The neck gets forced one way to the lateral side, stretching that plexus, and then it shoots numbness, tingling sensation down the arm. Spinal and cranial nerves, okay, they help the body to respond in changes in the outside world by using those sense organs. So the spinal and cranial nerves notice a change in hearing, or they notice a change in the light that's in outside. When we step outside and it's super sunny, then we sense that all that light and it sends a message to the brain. Oh my goodness, it's so bright. Maybe our eyes will constrict a little bit. We might, bring our hand up to our face to kind of shield some of that to get used to that sunlight. All of those sense organs gather the information and then send it to the central nervous system. And what is the central nervous system? It is the brain and the spinal cord. Okay. When we're looking at functional classification, we look at the sensory division and the motor division. And when we see sensory, that is those nerves that carry impulses from the central nervous system from the receptors. Okay. So it takes um, the impulses, the change in stimulus from those sensory organs and sends it to the brain. Afferent means toward. Okay. When we see the motor division or efferent means away from. So it's those nerves that carry impulses away from the central nervous system to the organs, the muscles, and the glands, which creates some sort of motor response. Okay. So our sensory organs gather this information, send it up to the brain processes it, and then effects what happens. And that's how you can think of it as effects. It affects us bringing our hand to shield our eyes. It affects that we want to put on a coat or that we hit the gas pedal because we saw that light just turned red. So here's another picture just to help you kind of keep sensory and motor nerves separate in your head. We're looking at eyes, ears, nose, our skin, our tongue, all of those sense organs use those afferent nerves to go up towards the brain. And then on the flip side, the brain processes the information, uses efferent nerves to send it back out to the nose, eyes, arms, legs, and tells us how to respond. Within the efferent division, we have the somatic nervous system and the autonomic nervous system. Okay. The somatic nervous system consciously controls our skeletal muscles. The autonomic system carries those impulses away from the central nervous system to the glands, the heart, the blood vessels, and involuntary muscles. So these are the things that we don't think about. These are the things that we respond automatically. Okay, so like we talked about, when you step outside and it's a beautiful sunshiny day, and your eyes sense that sunlight, send a message to the brain comes back and constricts your pupils. Okay. Or on the flip side, we go into a dark room and we don't have enough light to see properly. So that message goes up to our brain. We can't see well. And then it comes back out with our eyes dilating so we can gather more sunlight or more light. Within the autonomic nervous system, we have both the sympathetic and the parasympathetic nervous system. Okay, there are two parts that act opposite of one another. One stimulates and one inhibits. The sympathetic system, when you think of sympathetic, think of kind of that stressed automatic response, kind of that fight or flight response. Okay, so we're in crisis and we act with sympathy. We act sympathetic based on that kind of crisis mode. Then the parasympathetic is kind of that time afterwards where we can relax and get back to normal or get our body back to that baseline of normal. Okay, so if we're thinking about a fight or flight response, okay, we're in a kind of a crisis mode. We really panic. Our lungs dilate and allow us to really breathe faster, breathe harder, bring in more air. We kind of get that natural response to react quickly. And then once that threat calms down, then the parasympathetic system gets us back to that normal. Okay, because if we're just constantly in crisis mode, then our blood pressure, our heart rate, everything just keeps elevating, which will obviously cause some issues. Looking back at the autonomic system, Okay, it regulates things that are automatic. Okay, so three examples of that would be controlling smooth muscle, which are, remember, our digestive organs and our urinary tract organs. And then the cardiac muscle. Of course, we don't have to think about the fact that we want our heart to beat. We don't think, oh goodness, this is a scary situation. My heart rate should rise. And glands. We don't think about the fact that we ate all that candy and our blood sugar level is really high. And so we need some of that insulin to get that back down. We're going to stop there for today. And next time we will pick up with nervous tissue, the structure and the function.